Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you for joining us here on this Health Suppliers segment. Mr. Vince Parry is here to discuss healthcare branding industry, what works, what doesn't work, and also to talk about his book, Identity Crisis, Healthcare Branding's Hidden Problems and Some Proven Strategies to Solve Them. Mr. Parry, how are you?
I'm well, thanks. Thanks so much, Neal, for having me on.
I'm glad that you could take the time. We're talking about branding in healthcare, so I'm just going to go ahead and throw this out there. When you're talking about branding, you're talking about the same type of branding that goes with Coca-Cola or Twinkies or anything else. Is that right?
Yeah, that's right. It's creating a brand identity, a way that a brand looks, acts, and behaves so that audiences get a clear understanding about what values the brand stands for.
Should we expect the same type of reaction? Is that what we're looking for, the same types of reaction from the consumer that we get from the commercials, from Coca-Cola, and, as I said, any other type of food or car or anything else?
Yes and no. Yes, in the sense that healthcare brands need to have a consistent identity that has integrity to it. It's a little different that healthcare brands are not a celebration of self. They're more a restoration of self. And so people react to healthcare brands looking for ways of restoring aspects of their identity that illness has taken away, as opposed to consumer brands, which people use to celebrate their identity.
So I've got this condition, and I want it to be treated. I want to get properly diagnosed. I want to get properly treated, surgery, whatever. I'm looking for a specialist. I'm looking for a doctor. How does healthcare branding help me as the healthcare consumer?
Well, it basically paints a picture of brands that reflects the values that you have. So, for example, if you have psoriasis or multiple sclerosis or diabetes, you're looking for brands that fit in with your lifestyle, that restore aspects of your identity in ways that help you be you. And they're usually very discreet. You can almost think of a healthcare brand as a doctor in a pill or a doctor in a bottle, if you will. You're looking for the same values you would in a doctor: intelligence, discretion, honesty, experience, things like that. It's not as flashy as consumer branding because obviously people want it to be more discreet. But most of the times people don't want anyone to know that they have an illness.
Okay, so I can get my mind wrapped around branding as far as pharmaceuticals go, or even a hospital has its own way that they do open heart surgery. But how does a physician brand himself and his area of expertise or his values?
Well, it depends on what kind of specialty they are. Different doctors create different types of brand identities based on the specialty they go into. So, for example, you take pediatricians. Their brand is basically about their love of children, and pediatricians are doctors that actually spend more of their time preventing illness than treating it. They vaccinate, they try to keep a child well. An obstetrician goes in because they love basically to help women stay fertile and have babies. Basically, it's the attitude they have about how they integrate with the patient to help the patient achieve their best selves and keep illness at bay. So again, a doctor is really a reflection of the values a patient has in terms of what am I trying to achieve by this doctor's visit? What am I trying to achieve by getting rid of this disease, or at least making it less troublesome for me?
You're a 30-year veteran of this healthcare branding industry. Briefly talk about how healthcare branding has evolved based on what it was when you got into this industry and how you have been a part of helping it to evolve.
Well, branding used to be not thought of at all. The healthcare industry is fairly backwards when it comes to marketing because people don't want to buy these products. They have to. And so it was really a selling-based model. They were aggressively sold to doctors and to patients in print. That's before 1996, before the TV commercials were allowed to be on the air. And basically, they were just very aggressively sold to doctors. They were all about features and benefits. They were all about different price points and things like that. all about the brand themselves. Branding has evolved to be more about the customer. How does the brand help the customer? How does the brand create an identity where the customer, again, sees that reflection of their own values? And that's been a recent phenomenon, I'd say within the last 10 or 15 years, that healthcare branding is catching up to consumer branding.
You've written a book, Identity Crisis, Healthcare Branding's Hidden Problems and Proven Strategies to Solve Them. Does this book talk about whether branding is an entity and it takes on a life of its own, or can the physician carefully brand himself to make sure that it doesn't come off wrong and maybe be mistakenly viewed as a celebration of self rather than what the goal truly is?
Yeah, absolutely. I think the book contains several different things. The book contains certain in-the-trenches points of view on things that go wrong in healthcare and how to fix them. And then it has a series of steps that I call the Goldilocks process that, if followed, can help anyone begin branding and really use the best practices to brand themselves. It's a discovery. It's understanding exactly what customer base that you're trying to appeal to the most. Who you want to be your brand loyalists. How to take that and form a strategy to connect with your customers in a way that's differentiating from other physicians. And finally, even in the visual way that you present yourself, what's the name of your practice? What's the visuals inside the office? What's the setting? What does that say about you, for example? All of these things really dress up the brand in ways that make it a consistent beacon so that patients can really understand exactly what this physician stands for.
What about some case studies, some eye-opening case studies? Are those included in the book as well?
It's filled with case studies. It's filled with case studies and with color illustrations as well, which a color book is really difficult to produce, but because we're dealing a lot with visual identities, I felt it was absolutely imperative. So there are case studies of all sorts, of all specialties and of all types of drugs and services, hospitals and things like that. That's what I feel makes the book really, really practically relevant in the healthcare space, is because it uses real examples that I've worked with myself, so that they're absolutely true, and you get the insights that we got as we went through all of the steps.
You're the founder of New York-based Parry Branding Group, and as I said, the author of Identity Crisis. Where can we go online and get some more information about your company and pick up a copy of your book as well?
Well, you can go to my website at parrybrandinggroup.com, and that's Parry with an A, P-A-R-R-Y. Parrybrandinggroup.com. My book is advertised there, but you can go to any online book retailer like Amazon.com or BarnesandNoble.com, and it's available in both paperback and e-reader formats.
Vince Parry, thank you so much for joining us here on the program today. It's been a pleasure.
Thank you so much, Neal. My pleasure.
You've been listening to Health Professional Radio on this Health Supplier segment. I'm your host, Neal Howard, with Mr. Vince Parry. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm.